One of the most dreaded diagnoses in medicine is that of breast cancer, and it's divided into 5 main stages. Advanced breast cancer is included in the most serious of these stages, metastatic breast cancer, and is diagnosed in nearly 30% of all breast cancer patients.
Now, for metastatic breast cancer, we don't have the ability to use the cure word, really, ever.
The first thing you think about is, I need to be here for my kids. I need to fight through this. I mean, that's why you do this, because, you know, your kids, how are they going to live without a mom?
We've made tremendous advances in the treatment of advanced breast cancer, and if we look back 10 years, it's in some ways unimaginable where we are now compared to 10 years ago. We can help women live longer now than ever before.
And I get to have my hair, and I don't feel like I'm walking around as a billboard, I have cancer.
I'm Dr. Scott McFarland. Join us as we take a closer look at one of the deadliest forms of cancer, advanced breast cancer. We will see how researchers and physicians are offering patients greater hope with new effective treatment options. And we will meet an inspiring woman who is choosing to live life to the fullest while managing this devastating disease. That's all coming up on Healthy Body, Healthy Mind.
Major funding for Healthy Body, Healthy Mind is provided by Novartis Pharmaceuticals Corporation, whose mission is to improve people's lives by pioneering novel healthcare solutions. And by Baxter. And by Janssen Pharmaceuticals, dedicated to addressing and resolving the major unmet medical needs of our time, driven by our commitment to patients, healthcare professionals, and caregivers to advance patient care. And by Genzyme, whose mission is to discover and deliver transformative therapies for patients with rare and special unmet medical needs, providing hope where there was none before. Additional funding provided by American Medical Systems and by Celgene.
A diagnosis of breast cancer can be a devastating moment for any woman. It's not only a life-changing disease, but possibly a life-threatening one as well. With some types of early-stage breast cancers having 5-year survival rates of 100%, there's hope. However, as we will learn, advanced breast cancer, which is breast cancer that has metastasized or spread to other parts of the body, though treatable, currently has no cure. Mother, daughter, wife, sister, friend, neighbor. Statistically, 1 in 8 of these women in America will develop breast cancer sometime in her life.
When a woman is diagnosed with breast cancer and she starts talking about it, she finds many, many, many women will say, I've had breast cancer too. It's that kind of common. About 200,000 new cases per year, well over 1 million plus women living, with a history of breast cancer, about 40,000 deaths per year. And if you take all breast cancer put together, about 25 to 30% of it will become metastatic at some point in that woman's life.
Dr. Joyce O'Shaughnessy is chair of breast cancer research at Baylor Salmon's Cancer Center in Dallas, Texas. Over her career, Dr. O'Shaughnessy has made significant contributions to the improved outcomes for breast cancer patients.
Breast cancer is a malignancy that arises inside the breast ducts and also in the breast lobules. That's where the milk is made. It starts there and then it invades outside of those confines of the ducts into the breast tissue. Once it invades, it can metastasize. Those cells can leave their origin which is the breast, and travel to the lymph nodes in the armpit, called the axilla, or to other places in the body, the vital organs, bones, liver, lungs, and brain.
Dr. Hope Rugo is professor of medicine and director of breast oncology and clinical trials education at Helen Diller Family Comprehensive Cancer Center at the University of California, San Francisco. Her research interests include new therapies for advanced breast cancer and supportive care.
We can divide these breast cancers into the more rapidly growing, fast-growing, so-called triple-negative cancers, HER2 positive cancers, or hormone receptor positive cancers.
In order to grow, the hormone receptor positive cancers rely on female hormones such as estrogen and progesterone.
The most common is the estrogen receptor positive. About 66–70% of breast cancers have these estrogen receptors, and they really are dependent on estrogen. The second kind is the HER2 positive. About 15–20% of the time when a cancer is developing, suddenly you have too many copies of this normal gene, HER2. We don't know why that happens or how it happens, but when it happens, it's in charge. Lastly is the triple negative. It's not fed by estrogen, it's not fed by the female hormone progesterone, another female hormone, and it's not fed by the HER2. It's a bit of a grab bag of cancers. About 15%, 18% of breast cancers. It's very fast growing. It's our greatest challenge, quite frankly.
We know that the more aggressive, rapidly growing cancers, they recur sooner after diagnosis, whereas the slow-growing ones might recur even at 10 or 14 years after diagnosis. So one question comes up is who's at risk for developing recurrent disease and what those risk factors really are.
The most important thing by far there is whether or not the lymph nodes underneath the arm, the axilla, are involved with breast cancer, and then it's how many are involved. 4 or more nodes puts a woman at high risk of developing metastatic disease because it means that many cancer cells have the machinery to travel from here to there. That means they have the machinery to travel elsewhere in the body as well. You can still develop metastatic disease even with no lymph nodes positive because the cancer cells can metastasize through the bloodstream.
We also know that some subtypes of breast cancer have a higher risk depending on the response to treatment. For example, it used to be that HER2 positive cancers, this marker of aggressive cancers, those had a worse risk. But now that we have targeted treatments to that subtype of cancer, those are among the best risk categories.
Just outside of Dallas, in Farmers Branch, Texas, you can find Melanie Orm, a wife, mother of 3, and now grandmother. Melanie lives her life in such a way that outside observers would never know she's been battling breast cancer for the past 18 years.
I'm going to make the best of each day because, let's face it, none of us know when our time is up. My family, we're very active. I exercise 6 days a week. We bike, we play tennis.
Melanie has even run a marathon.
When I ran that marathon, was, hey, a lot of healthy people can't run a marathon, so I'm gonna run this. I was first diagnosed with breast cancer in 1996. It was stage 1, it was very small. Since I was so young, we just opted to just do a mastectomy. And really, that was it for that course.
Melanie then went about living her life cancer-free for the next 8 years, until one day.
I felt a small lump on my neck. I was always really careful about if there was any change in my body that I'd go talk to my doctor about it. He said, let's just remove it just to make sure nothing's wrong. And so I had been scheduled for this surgery, and the doctor's office called and said, we need to postpone the surgery because your chest x-ray came back with some spots in your lung. They did the biopsy, and it came back that it was breast cancer. The thought of having metastatic breast cancer at that time in my life was devastating. I mean, I really thought I was gonna die. It was spring, and I just kind of bought a bunch of spring clothes, and I told my husband, I guess I have to go return these.
Because breast cancer remains the second leading cause of cancer death in women, addressing the emotional strains of this disease can seem as important as the physical strains. And doctors are very aware of this. It's a sensitive area, but one that needs to be talked about openly and honestly.
One of the questions that a woman will ask me, and we want to talk about over time, is what is the outlook? How long will I live, and what will the quality of my life be? That again is very much dependent on the biology of the cancer and to the patient themselves.
The average lifespan for metastatic breast cancer for the triple negative breast cancer is 18 months. For HER2 is 4 to 5 years. And for the kind of breast cancer that is fed by estrogen, the average lifespan is probably 5 to 8 years. A small minority of women will live 20 plus years with metastatic breast cancer.
If we look back 10 years, it's in some ways unimaginable where we are now compared to 10 years ago, and particularly more than 10 years ago. We can help women live longer now than ever before.
You have to remember, back when I was diagnosed at 32, what they did with stage 4 breast cancer was basically just send you home and make you feel comfortable. 10 years ago, when I was 40, was just when they were starting to say, we're gonna try to treat this like a chronic illness. Let's start slow. Let's not, bring in the big guns at the beginning, although that's kind of the treatment that I started with.
To fight the cancer that now had spread to her left lung, Melanie began a combination chemotherapy treatment.
Actually, I was going to go through 6 rounds of that. After 3 rounds, we did a CT scan, and the nodules in my lung were gone. And so I just did 3 more rounds and then went on the hormonal treatment. And I did that for 7 years.
We, most importantly, want to prolong her survival for as long as possible, and we want to keep her without progression of her disease. We want to keep it in control, in remission if we can get it there, or at least in control for as long as is possible with each and every one of our treatments.
3 years ago, it came back. It's always just stayed in my left lower lobe, and so we made the decision to go have it removed. I went on 12 rounds of chemotherapy, intravenous chemotherapy, and with a combination of an oral. And everything looked really good. Up until this point, I'd gotten pretty good mileage, 8 years, then 7 years. But after a while, breast cancer figures it out. And so it mutates and finds a way around these hormone blockers. And so it was only about a year that I got mileage off of this drug, and some spots came back in my lung again. So once again, that was a big bummer. I switched up treatments, and this time it was only oral.
There are many different treatments available to treat advanced breast cancer. We use the treatments that work well for early stage disease, a variety of different chemotherapy agents. We have targeted biologic agents, and then we have a host of hormone therapies. They're drugs that block the effects of estrogen or block the production of estrogen. And then there are agents that we can add together, and they work better.
Unfortunately, some of the current recommended therapies have negative side effects that can severely affect a patient's outlook and quality of life. Depending on the therapy, side effects can range from loss of appetite, nausea, fatigue, neuropathy, bone or joint pain, as well as redness and soreness of the hands and feet, to name a few.
I was worried about some of the side effects.
Wendy Brown is a substitute teacher in San Francisco who enjoys quilting and folk dance. Wendy is currently undergoing chemotherapy treatment for breast cancer.
I thought that when you have cancer, you're always feeling sick and you're always throwing up and you're haggard and you're tired.
What we're doing to try and counter those side effects is to give chemotherapy in smaller doses more frequently. We try and avoid giving multiple drugs together when we can. We try and vary the types of treatment. And then, of course, one of the things that's made a huge impact on quality of life is being able to keep the white blood cell count strong. And that's avoided the risk largely of infections during treatment and of mouth sores.
One of the most recognizable side effects of cancer treatment is the loss of hair, which can be very emotionally taxing for some women.
It's the most surreal feeling to just have hair, just watch it just come out.
Hair loss is one of the biggest issues. It's just seen as a public sign of illness.
There's different things in women that, their breasts, for one thing, is what makes them sensual and desirable. And the crazy thing is, so is hair.
So we became interested a number of years ago in trying to reduce or prevent hair loss.
When I had the recurrence 3 years ago, my son was getting married that summer. And I was like, I really want to keep my hair.
Melanie decided to use a therapy that was newly available at the time, called cold cap therapy, where cold temperatures are used to actually slow or reduce the effects of hair loss due to chemotherapy.
Now we have new systems that actually are quite effective at preventing hair loss or reducing hair loss for the majority of types of chemotherapy that we give. So the way scalp cooling works is it reduces the metabolism of the hair follicle cells that make hair, and it also reduces the amount of chemotherapy that's seen by those hair follicle cells by just causing vasoconstriction or narrowing of blood vessels that feed the hair follicle cells.
What happens is they put the cold cap on, and for the first 20 minutes, it's lowering the temperature of your head. And what happens is it lowers it a little bit, and then it stops, and it lowers it a little bit more.
They might lose 30% or even more of their hair. But what that means is that they start growing their hair back right away. They have most of their hair, so then they're able to go without any head covering, even if they've lost a fair percentage of their hair much more quickly.
And I get to have my hair, and I don't feel like I'm walking around as a billboard, I have cancer.
So I did lose some hair. I had my hair for my son's wedding.
Sometimes I just have to say, any hair day is a good hair day.
As the medical community continues to develop better strategies for managing the side effects and long-term toxicity of advanced breast cancer therapies, some patients are finding that they are able to maintain a functional role in society as patient longevity improves. Coming up, we'll look at how the research community is developing breast cancer treatment strategies that take a more individualized approach, targeting the specific biology or mutation of cancer cells. Breast cancer in men is rare, but does occur, accounting for 1% of all breast cancers and 1% of all cancers in men. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv.
When a woman has metastatic breast cancer, it is critically important that we keep her strong. The stronger she is, the more normal she is, the better she's going to benefit from the therapies, actually.
Studies show that the survival rate is significantly higher for those who exercise.
They have much more energy, and they have many fewer side effects in general.
I feel that that has helped me not only physically, but mentally.
So I actually think that physical activity and a good diet and healthy lifestyle is very important.
I felt like I ate healthy and exercised, but I did make some changes when I was diagnosed with metastatic breast cancer. We juice, we do smoothies. I just have lots of healthy fruits and vegetables, and I feel like that's, played a role in staying healthy, trying to do what I can on my part. I understand this disease kills women. I understand that some women are so sick during treatment and get so sick because of the disease that they're not able to do that. But I also acknowledge that many, many women can fight through this. Eventually, it will take our lives, but you have to have fighting spirit. I always say you find the best medical care you possibly can, and then you have them fight for you, and then you fight.
Advanced breast cancer patients, and the thousands yet to be diagnosed, are looking to the research community to diligently seek answers in all areas of breast cancer care, including new, more effective treatment options. So what does the medical community see for the future?
I see, first of all, less metastatic breast cancer just in general as our therapies for early breast cancer become increasingly good.
We've actually made probably our biggest advances in the area of HER2-positive breast cancer with a lot of very cool, well-tolerated, and highly effective agents, and now are seeing an explosion of new agents to treat hormone receptor-positive breast cancer, the most common subtype we see. One area where we still need to make big improvements is understanding and treating so-called triple-negative breast cancer.
Some of our new immune-based therapies that are aimed at allowing the woman's immune system to awaken and not be turned off by the cancer. Some of these therapies are holding great promise right now.
By working with our collaborators in the laboratory, we've been able to understand, and we're still early in this, the genetic changes that drive cancer growth, and most importantly, resistance to specific types of treatment.
We really are looking for mutations, and a good example is that HER2, because going after that HER2 has made a huge difference from a 1-year survival for metastatic HER2 positive to a 4 to 5 year survival. There is a huge effort to find other gene mutations like that that could then be targeted with that kind of effectiveness.
We've made some big advances in the past, but we're looking for some big progress in the next few years. All of the advances we've made in the treatment of breast cancer and other cancers are based on clinical trials.
I think it's great to be involved in a clinical trial because that's how advances are made. And for me, if there's no negative side effect to my health, I'm willing to do whatever.
And there have been some studies that suggest that patients who participate in clinical trials overall live longer, possibly because there are more treatment options for those patients.
So the reason to participate in clinical trials is to have a better outcome, but also you're making a super important contribution to getting the answer more quickly as to whether that therapy is useful, and if so, it's going to be approved by the FDA and become commercially available.
If something good comes out of my breast cancer, why not?
I'm on a drug right now, which is supposed to trick the cancer back into being responsive to hormones. But my tumor markers are going up slowly. We're kind of watching it really closely to see if we need to switch the hormone treatment, or there's also a clinical trial that Dr. O'Shaughnessy is looking at. I've been dealing with it now for over 10 years, and I've lived life to the fullest. I think that if you give in to it, then that's when it takes you.
So hopefully I can just continue to get through all this, so that the long-term side effects pass me by and don't occur. And probably by summer, I hope that this will be a memory.
Just this past year, I had my first grandchild. We can eat some yummy food. And sometimes I look at him and it's just, amazing. Because 10 years ago, I didn't know if I would be here to see him.
It's encouraging to see that new discoveries continue to be made in the treatment of advanced breast cancer. Some medical experts believe that in the future, they may be able to inhibit the metastasis of breast cancer altogether, bringing them closer to a possible cure. That's all for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itvIsus.com or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by Novartis Pharmaceuticals Corporation, whose mission is to improve people's lives by pioneering novel healthcare solutions. And by Baxter. And by Janssen Pharmaceuticals, dedicated to addressing and resolving the major unmet medical needs of our time, driven by our commitment to patients, healthcare professionals, and caregivers to advance patient care. And by Genzyme, whose mission is to discover and deliver transformative therapies for patients with rare and special unmet medical needs, providing hope where there was none before. Additional funding provided by American Medical Systems and by Celgene.